start off with you introducing yourself.
Well, I'm a board certified plastic surgeon. Um, I've been in practice for about 17 years. I do complicated body contouring procedures, plus size tummy tuck. Also published bra line back lift. We're located in Scottsdale, Arizona. Um, we are focused first and foremost on safety and then great results. So we tend to cross our T's and dot our I's with respect to how we set up our facilities, fully licensed surgical center, Class C, also across the street from the hospital. We have great staff, great protocols. I'll stop there.
Perfect. Our first question: what is the fastest way to heal up open wounds after a back lift and tummy tuck?
Well, we have to identify why there's an open wound there. I think that's probably the most important part. So what we're obviously, you have some type of a wound somewhere, and then so we have to define why that wound occurred, and then some of the qualities of that wound, and then from there, we can define the optimal way to heal. Usually, it's you have to have a clean wound, then you have to have a well vascularized wound. You has to have good blood supply, and then you have to protect it from additional, getting excessively dry or excessively wet. Protect it from contamination and irritation. Then obviously optimize your health as well, so your body has all the building blocks to heal well. So I think the most important part is to really have a look at that wound and try to understand how that occurred, and what that specific wound needs to heal the best. Different areas of the body have different blood supply as well. So for example, let's say I had a wound, here, a full thickness wound, and you can pick your way to create that damage. And then I had the same exact type of damage and the same exact depth of wound, let's say on my shin or on my ankle. This is going to heal at 10x faster than my ankle and my shin because of the amount of blood supply in the face compared to the lower extremity. So great question. Unfortunately, we cannot answer that without really knowing more about that wound, its location, and what it might need to heal at its optimum.
When looking for a surgeon, what should be your top question to ask? What would be red flags as a patient?
Yeah, that's a great question. I think honesty, that's probably the biggest red flag. So obviously there's a lot of things have to line up. It's like saying, what's the most important part of flying safely in an airplane? Well, there's a lot of things that have to happen in order to be safe in an airplane, so it just can't be one. So for looking for a surgeon, you want a board certified plastic surgeon, board certified by the American Board of Plastic Surgery, which means they went to a formal residency, which is 6 years, and then potentially even done a fellowship beyond that, as opposed to like a weekend course somewhere, things of that nature. So board certified plastic surgeon by the American Board of Plastic Surgery. And then you want to have someone that can show you that they've done a lot of surgeries of what you are looking for. The aviation example from that is, I might be a great pilot in a small plane, but you put me in a different plane, probably not going to do a great job. And so you want to have a surgeon that does the things that you need a lot, and when you look at their results, you like how they do things, right? So initially I said honesty, because when you go see someone, you can ask, well, are you a board certified plastic surgeon? And if they say yes, well then, are you board certified by the American Board of Plastic Surgery? And they obviously should identify if that is the case. And then, have you done my cases before? And, have you had any kind of complications? So basically, you want to have a good working relationship with your surgeon, where the surgeon is not there to protect their ego or protect their financial interests. They're there to really communicate clearly and honestly who they are and what they can do, and then the recommendations, and then you as the patient could then look at that and like, okay, that is good for me or sufficient for me, or no, that is not. That doesn't mean that that surgeon is bad or good. It just means that you're acknowledging that what you're looking for is not what that surgeon can offer, and that's the best interaction between two entities, the patient and the surgeon, or the customer and the business.
If I live out of state or out of the country, how do I get to come here and get surgery with you?
Yeah, about 50 to 60% of our patients are out of state or out of the country. It makes more sense to do a virtual consult first as opposed to in-person consult, because then you'd be flying for the consult, flying back, and flying back for the surgery. So you're welcome to do either a in-person consult or a virtual consult. It's up to you, but obviously a consult has to be done prior. So you start off with a consult. We evaluate what your needs are, what your goals are. We provide you with a quote. We make sure that you're safe to proceed with surgery. And then at that point, you can make a decision whether you want to proceed and choose a surgery date. So then once you choose a surgery date, you have to be here at least a day or two before surgery. You don't want to come in like in the evening before your surgery. So you want to come here, at least 24 or 40 hours before surgery to get acclimated. That gives you a chance to do an in-person pre-op with me. And then you have surgery. And then if you have a big body contouring surgery like a plus-size tummy tuck, you want to stay in the Scottsdale area for about 2 weeks.
What is the most amount of procedures you have performed on one patient at one time?
So there's two variations of that question. What are the number of procedures that I performed on a person, and how long have I operated on someone in one day? And the reality is that how long I've operated on someone in one day is the more important question, because the number of procedures varies based on the size of the individual. So for example, a 6 foot tall person that needs a lot of lipo, the incisions are longer, things of that nature, may only be able to do 3 procedures. For example, tummy tuck, broad line back lift, breast lift. For example, in a 6 foot tall woman that's maybe, let's say, 350 pounds, that might take us 10 hours, right? Or 8 to 10 hours. Well, on a 5 foot tall person that's 250 pounds, we might be able to do 4 procedures or 5. So I'd have to look back to see how many procedures I've done on any one individual. I know I've done at least 4, and I think I've done a handful of patients 5, but they've been fairly smaller patients, still bigger than average, but relatively smaller. And the longest I've ever operated on someone in an outpatient setting, I think, was 12 or 13 hours. I've done maybe half a dozen patients in that 12 to 13 hour range.
Is it safe to perform cosmetic surgery on someone who is taking high blood pressure medication? What type of anesthesia is safe for them?
Well, you can have medical diagnosis, medical issues like a history of hypertension, a history of high blood pressure. And as long as it's controlled, then it's not really much of an issue. Same thing with diabetes, same thing with a lot of different things. So as long as your heart and lungs are strong and healthy, then you can have surgery safely. Then there's no reason to not proceed. So a lot of our patients are on some type of medication for blood pressure, diabetes, various other things like that. So as long as those medical situations are controlled, they're not really impacting the surgery or the safety of the surgery. When we do big body contouring surgeries, I do general anesthesia, or at least my board certified plastic surgeon does general anesthesia. And the reason for that is twofold. One is it helps us do the surgery faster, because if we're already doing 8, 9, 10 hour surgeries, if you're trying to do it under like sedation with local anesthesia as well, then it's going to take you much longer. And the second part of that is when you're doing a long case, if you're using a local anesthesia in addition to sedation, you're going to really go beyond the safe limits of the anesthetic, the lidocaine. And so for safety, general anesthesia for big body contouring surgeries, general anesthesia is a safer route.
Do you have facilities for out-of-state patients? Would it be safe to fly back home after a few days?
Well, if you're getting a breast augmentation, the answer is yes. Simple surgery, get breast augmentation, fly back in a couple days. Flying back in a couple days after a big body contouring surgery, plus size tummy tuck plus, bra line back lift plus breast surgery. Those are fundamentally different surgeries because the physiological change to your body are bigger, and therefore your body needs some time to recuperate energy, third spacing of fluid shifting in and out of your vessels. So the idea that you'll have a big body contouring surgery, the type that I do, where I take 20, 30 pounds of tissue off and 5, 6, 8 liters of liposuction fat, and then fly back home in 2 days, is not reasonable, but it's also not safe. Your body needs to rest. It's the equivalent of you getting the flu and then saying, well, can I fly long distance the next day with the flu? Well, yes, you can, but first of all, you're going to feel terrible. Second, you're really increasing the chance of your body not being able to do both, muster the energy to travel and muster the energy to heal. So we recommend people staying here for about 2 weeks after the plus size tummy tuck or a big body contouring procedure.
Do you ever perform surgeries in other states or countries?
I do not routinely do so. I've performed some surgeries for a conference with my mentor a while back, and I still have my medical license in California, but I don't practice surgeries outside of Arizona, and even more specifically, I don't do surgery outside of my own surgical facilities. And the main reason for that is I have really created a very narrow path for both safety but also our results. And that's narrow path where on one side you become maybe a little too unsafe, and on the other side you become a little too conservative. So that narrow path is built in my facility because I have been able to control staffing protocols, equipment, the facility itself. So that's how I feel like I'm able to really do both safe surgeries and get great results by really controlling all that environment. It's, I guess, the equivalent of like having a very complicated automotive problem and then you take it to a specialized mechanic and they have their own tools and diagnostics and their staff and everything else over there. And the equivalent is like having that person come to your house to try to fix a car. They're not going to be able to do the same type of job.
What is the price for a consultation, and can you just explain your pricing in general?
Sure. Yeah, so our consultation fee is $250. That consultation fee is applied to your account, meaning if you end up having surgery, then the actual surgical cost is that $250 is applied to the actual surgical cost. So the consultation ends up not costing you anything. So that's the first step, is getting a consultation fee. And that's the same $250 for virtual or in-person consult. And then once you decide you want to have surgery, you have to deposit $2,500 to reserve a surgery date. That is also applied to your account. So that gets applied towards your actual surgical cost. And then the actual quote is built based on what is needed in terms of time to accomplish the results that you're wanting. So if you want a plus size tummy tuck and you're 6 foot tall, that's going to require, let's say, 4.5 hours of surgery. And if you're 5 foot tall, maybe that requires 3.5 hours of surgery. And that results in different costs, because all of our costs, my surgeon's fee, the operating fee, the anesthesia fee, are all based on the amount of time that is required to be in surgery. And then, of course, if you have more surgery, more procedures, then the cost goes up because the time goes up.
Do you do full body lifts?
Well, you have to define what a full body lift is. So, for example, an excisional buttock lift with a tummy tuck in the front can be considered a lower body lift. Okay, that's generally what a lower body lift is. And if you do a bra line back lift, that's an upper body lift. So if you do a bra line back lift, excisional buttock lift, tummy tuck, that's a full body lift. And so if that's your definition of it, the answer is yes. The reality is there's really no limitation to, other than the amount of time in the operating room, of what can be done. So if your definition of a full body lift is breast lift, tummy tuck, bra line back lift, arm lift, or whatever else, the answer is yes. I do full body lifts, and then at some point you max out that day. 10 hours of surgery is getting pretty close to our maximum amount. Not for the safety of the patient, but it's really for my capabilities physiologically. After about 9-10 hours, I start really getting a little bit on the lower side of energy. So that's kind of the amount of time in the operating room that we look to wrap it up. Once we get to about 10 hours, that's about time to stop.
When do I need to stop taking my GLP-1 medication before surgery, and then how long after surgery can I start taking it again?
Yeah, so GLP-1 slows gastric emptying activity, meaning the stuff tends to stay in your stomach longer than it usually is. So depending on what organization you look at, some say a week before surgery, some say no need to stop it. In my practice, we have decided to do 2 weeks before surgery, and here's my reasoning for that. You might be able to cut it where you only do 1 week before surgery, and you might be able to cut it by not even doing any before surgery. But if you do, let's say 100 patients, and out of that 100 patients, one person has too much stuff in their stomach because of delayed gastric emptying, and then they regurgitate or throw that up during the process of intubation for general anesthesia, and that stuff goes in their lungs, and they get basically a contact pneumonitis, they get the aspiration pneumonia. That person could be very sick, and it might even be fatal, and they might be in the ICU for a long period of time, and bad things happen. So my reasoning is, why take a chance, right? So in our practice, we say 2 weeks before surgery, stop your GLP-1, and then usually you want to wait at least a couple weeks afterwards. And the reason for that is you're not really hungry after surgery anyways. 2 is we don't want gastric emptying delaying because we want you to drink lots of water. So that's our reason for that.
Up to how many liters of fat is safe to remove in a liposuction session? That's
variable based on the height of the person, their physiologic parameters that they can sustain. So 22-year-old, 6 foot tall person is going to be different than a 65-year-old, 5 foot tall person. You have to we're not assuming that a 22-year-old is always stronger cardiovascularly compared to a 65-year-old, but in general, all things being equal. And then of course a 6 foot tall person, that amount of volume extraction is going to be less of an impact on them than a 5 foot tall person. That's just some rough ideas. We routinely take 5 liters out, 6 liters, 7 liters. Once we get into that 8 liter, then we start saying, okay, well, can this person reliably sustain this without being overly lightheaded afterwards? And if we think it is, then we bump it up and we start going a little higher, that kind of stuff. So we easily take out 5, routinely go 6, 7, even 8, and then we start really saying, well, are we risking too much to gain too little? Is it a long slide for what's that say? Long run for a short slide. Anyways, yeah, so easily 5 liters. You can go higher than that. I've taken out, I forgot now, beyond 10. I think it was like 12 or 14. That patient did great. They're a little lightheaded when they stood up for more than about 3, 4, 5 minutes. But otherwise they did great. They healed great. They had no issues. But we probably cut it a little close. So the answer is variable.
Can you do a Symmastia repair and add in implants in the same surgery?
There's 2 types of Symmastias. There's congenital Symmastia, that means you're born with no cleavage, the 2 breasts are merged together. And there's surgical Symmastia, that means your anatomy did not have Symmastia, and then surgery occurred. Oftentimes implants are placed, but sometimes with a breast reduction, different types of breast reductions, and then Symmastia was created from that. So the short answer is yes, you can do Symmastia repair and place implants. The more nuanced question and answer is, what type of Symmastia do you have, and what size of implants are you wanting to get? Because certain Symmastia repairs and certain size of implants may work against each other. And if that's the case, then you'll want to stage it. Do the Symmastia repair, let it heal great, then put those maybe bigger implants that you like in there. If you have congenital Symmastia and you're just trying to get a small implant, then the short answer is yes. But then if you're getting a small implant, the next question is why aren't we just doing fat transfer, or why aren't we shaping the breast tissue at the same time? So it's a more nuanced question requiring more information.
Do you have an age limit for surgery?
I do not, because just like BMI, age doesn't really communicate health of the patient. So you can have a 78-year-old that's totally healthy, and you can have a 38-year-old that's really not in a good physiologic or anatomic situation to have surgery safely. So safety is our first and most important parameter, and so we look at that. We look at the heart parameters, lung parameters, any kind of pre-existing medical conditions. We look at the tissues, we look at the person, we evaluate what they can do on a regular basis in terms of, like, a 78-year-old that hikes a couple of miles a day is going to do just fine with surgery, especially if they're cleared by the doctor. So imagine a 78-year-old that regularly exercises. They go see their doctor. The doctor looks at EKG, blood work, chest x-ray, past medical history, and they clear him for surgery. The chance of that person not doing well during surgery because of anesthesia is very remote.
Do you speak Spanish, or do you have anyone to help Spanish speakers?
We have a Spanish-speaking concierge in our office.
Will surgery interfere with autoimmune diseases such as lupus?
I don't see how it can. A lot of our patients have some version of autoimmune. We've operated on a lot of patients with lupus. We've not seen a flare-up with that. I'm not an expert, I'm not an immunologist, but we're not putting synthetic products in there like implants or things of that nature. So I don't think surgery, the type that we're talking about, will impact autoimmune conditions.
Do you do hernia repairs when you do tummy tucks?
Yeah, we do. I like to do an all-inclusive tummy tuck where we do everything that needs to be done. So liposuction, muscle repair, hernia repair, all that stuff's included.
What are the pros and cons of doing a fat transfer to the breast versus a breast augmentation utilizing implants?
Well, if the implant's very small, then the benefits or the differences between the fat transfer and the implant are going to be almost negligible. You're going to get a comparable result for both. If you're trying to get a fairly large increase in breast size, let's say you're going from a size B as in boy to a size D as in delta, you're going to want an implant, because fat transfer has a hard time getting 2 cup size increase in one surgery. If, on the other hand, you don't want an implant and you want a 2 cup size increase, you can certainly do that with fat transfer. It's just that you have to require multiple fat grafting sessions, maybe 2, maybe 3. So that's the biggest difference, is the amount of change in one surgery. Implant has a bigger power for that than fat transfer. The second component is whether you want a synthetic implant or not, a synthetic product or not. So if you want to avoid man-made product like an implant, then obviously your only option is fat transfer. And the final difference is you can order any implant that you want from a variety of different manufacturers. But with fat, you have to have fat, right? So if you're rail thin, if you're barely confined any fat on your body, you're not going to be able to do fat transfer to the breast. You have to have a breast implant.
What is the average time that someone would need to take off from work for surgery?
Well, it depends, right? So if you're getting a breast augmentation, maybe just a weekend. If you're getting let's say, the liposuction to the waist, either to the front of the waist or all the way around the waist, maybe a week off. And if you're getting a plus size tummy tuck or anything that or bigger, I'd recommend 2 weeks off. And those are probably minimum. Every surgeon's different, therefore every surgery is different. I tend to be fairly thorough with my procedures, and therefore the body really requires a lot of time to get that energy expenditure to heal. So sometimes my patients will come in and like, okay, ideally take 2 weeks off minimum, really try to take 3 or maybe even 4, because the more time you take off, the faster your healing is going to happen. And some of my patients might be like, well, my friend had a tummy tuck and they went to work in like 3 days. I'm like, that might be the case, but I'm pretty sure that your friend didn't have 30 pounds of tissue removed and 8 liters of liposuction done. Those are still called tummy tucks, but they're fundamentally different procedures. And therefore, they're fundamentally different energy and healing requirements on your body.
Final question, how do I get a consultation with you?
Yeah, so you can certainly message us here on Instagram. You can message us on TikTok. You can call our office the old-fashioned way. Our office phone number is 855-377-3782. But we also have 2 websites. There's drrepto.com and there's plussizetummytuck.com. There is a virtual consultation button at the top of those websites, and you can just click that. That's how you can get a hold of us.
Thank you.
Thanks, guys. Have a great day.